Hello, please subscribe and like for our channel. Thanks very much.
Hello, in this scan we are going to see, so this is the diagram, a CT scan that shows you a crescent shape hyperdensity. Is it clear? It shows you a crescent shape hyperdensity, and it goes a crescent. You have a crescent shape hyperdensity, and we have a shift, a deviation of a midline. Is it clear? And now in this case, you see very well that you can visualize the ventricles. You see the two part of the ventricle, the anterior part of the ventricle, and this is the posterior part of the ventricle that you can visualize here. Is it clear? So now here, what can you identify? What are the characteristics of this CT scan? You can see a crescent shape hyperdensity spanning from the frontotemporal aspect of the head. Is it clear? You have a crescent shape hyperdensity now spanning from the frontotemporal aspect of the head. It's a crescent and even isodense, because in the anterior aspect, that's the frontal aspect, you have isodensity or even a small hypodensity, and in the posterior aspect you have a hyperdensity. So it's a crescent shape hyperdensity spanning from the frontotemporal aspect of the head. Is it clear? So now this is a distinction from an epidural hematoma. For epidural hematoma, generally they don't span in two aspects of the skull, because you need to know that what epidural hematoma is much more localized to a particular sulci, a particular bone. Is it clear? Because it does not cross the different sulci. Epidural hematoma, since it's epidural hematoma, you have to know that it's located at this epidural space, and the epidural space, directly below the epidural space, you have the periosteum. Is it clear? Directly below the epidural space, you have the periosteum. That's why it prevents the flow of the blood all through the spans of the bone. While in subdural hematoma, the blood is inside the subdural space, and the subdural space is below the periosteum. So blood can span through two bones. Is it clear? So in this case, it can span through a wide space inside the brain. Is it clear? So it can span through the wide space inside the brain. While for epidural hematoma, it's going to be localized much more on one aspect. That's why generally we say subdural hematoma is much more severe or much more frightening than epidural hematoma, because subdural hematoma can span all through the brain, and it is also it's not going to be abrupt, meaning that the symptoms are not going to be visualized very early. It's not going to be abrupt, meaning that the symptoms are going to be visualized very early. So in these cases, they are very life-threatening as compared to epidural hematoma that occurs abruptly, and then the management can be done very fast. And they are diffuse. So in this case, that's what you can see as your characteristic. So you can visualize a crescent shape hyperdensity spanning from the frontotemporal and not parietal, temporal aspect of the head. So what's the diagnosis? It's an acute subdural hematoma. You can just say subdural hematoma if you don't want to say acute, or because it's also isodense. Is it clear? So just say subdural hematoma. Now the next thing is give two risk factors for subdural hematoma. Subdural hematoma, we have OH. OH is a risk factor of subdural hematoma, and the second risk factor of subdural hematoma is trauma. Is it clear? Generally, patients that have OH, they may not even have any trauma. They may just have a minimal trauma, but they have subarachnoid hemorrhage. You have OH, you have trauma, you have anticoagulant therapy. Patient with anticoagulant can have subdural hematoma. Now the next one is give three differences between figure 1 and figure 2. In the figure 1 that was above, you have this. Is it clear? It is a biconvex, and you see that it is much more localized on it's much more localized on the one aspect of the bone. Is it clear? So it cannot span all through the skull like this second diagram. You see that this one is expanding, has a wide spread. Is it clear? Why this one is just localized on a particular bone. Is it clear? So it does not span all through the brain. That's one difference. The second difference is the one. This one is crescent shape, while this one is convex shape. Is it clear? So this is convex and crescent shape. So this one spans through a wider distance compared to this one. Is it clear? And this one has some iso and hypodensities, while this one has hyperdensity all through. Is it clear? So those are the different one. And this one also, so those are the different elements that you have to visualize. Is it clear? So from here we say thanks for your kind attention, and please don't forget to like and subscribe for our channel. Thank you.
Hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429, and please don't forget to like and subscribe for our two channels, Science Video Makers and SchrDbb. Let me say the number again: 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year. The workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook. All this we have on the no contact 652-659429. Thanks very much.